Broken heart syndrome. Emotional stress and stress resulting from various events, such as emotional breakups, the loss of loved ones, or larger tragedies, can have physical effects in addition to psychological effects. One of these effects is broken heart syndrome or Takotsubo syndrome. In medicine, broken heart syndrome is called Takotsubo cardiomyopathy. The word Takotsubo in Japanese means octopus trap, which resembles the shape of the hearts of these patients during angiography. Experts believe that the cause of broken heart syndrome is the excessive production of hormones, such as adrenaline, in a highly stressful situation, leading to disruption in blood flow and weakness in the muscles of the lower and middle parts of the left ventricle of the heart and affecting its function. Most patients are women who often have a history of losing a close person in their lives. The symptoms of broken heart syndrome are similar to a heart attack. In most cases, this condition presents itself with the following symptoms. 1. Sudden and severe chest pain, angina pectoris, the main symptom of this condition. 2. Shortness of breath. 3. Heart palpitations. 4. Low blood pressure. 5. Irregular heartbeat. 6. Fainting, syncope. Some triggers for this disease include 1. Asthma attack or hearing bad news such as being diagnosed with cancer. 2. Severe arguments. 3. Surprise parties. 4. Public speaking. 5. Death of a loved one. 6. Domestic abuse. 7. Loss or even winning a large amount of money. 8. Losing a job or financial problems. 9. Divorce and separation. According to research, 1 out of every 6 patients with broken heart syndrome also has cancer. The exact reason for the relationship between these two conditions is still unclear. It may be due to the mental and physical stress of cancer that these patients develop broken heart syndrome. In most cases, individuals who develop this condition recover and do not have long-term consequences. The consequences can be serious for some individuals, approximately 1 to 2% of affected individuals, but after hospitalization, the heart returns to normal within 1 to 4 weeks. However, sometimes this syndrome can be fatal. Some risk factors associated with broken heart syndrome include 1. Gender. This factor affects women more than men. 2. Age. Most individuals who develop this condition are over 50 years old. 3. History of neurological disorders. Individuals with neurological disorders such as head trauma or seizure disorders. 4. Previous or current psychiatric disorders. Disorders like anxiety or depression increase the risk of developing broken heart syndrome. Broken heart syndrome can become a serious illness, so its symptoms should be taken seriously. It is important to seek help from a cardiologist for diagnosis and treatment to receive appropriate care after necessary tests for accurate diagnosis. In the realm of art, broken heart syndrome is the subject of many outstanding and global works. And artists, through representing medical events and health issues resulting from a shocking event or tragedy like betrayal, can skillfully weave artistic expression and medical themes together to convey complex emotional interactions and physiological disturbances through sharp and concise images and symbolic elements, evoke empathy and reflection, and illuminate the multifaceted nature of heart health and human relationships at the same time. Philip Hermogenes Calderon, 1833–1898, was a renowned Victorian artist known for his emotionally charged and thrilling paintings that often depicted themes of love, betrayal, and human relationships. One of his most captivating works, Broken Vows, delves into the bitter intersection of romantic betrayal and the consequences of a heart attack. Calderon masterfully conveys the destructive impact of betrayal on emotional and physical health through a skillful combination of artistic expression and medical symbolism. Broken Vows tells the story of a woman hidden behind a lush garden, listening to her deceitful lover's extravagant whispers to another woman from behind a red brick wall with a broken gate. Her mournful and crestfallen expression vividly illustrates the situation, capturing a very bitter moment, as if a sharp dagger has struck at the power of her heart. In this captivating work, Calderon conveys the depth of emotional turmoil resulting from romantic betrayal through various symbols and visual clues. The beautiful inner garden space behind the broken gate symbolizes the lost hopes and dreams of the painted lady, highlighting feelings of emptiness, abandonment, loss, and betrayal. The initials of two names engraved on the gate reinforce the sense of betrayal, leading to feelings of loneliness and despair. With a wedding ring on her left hand, she clutches her heart. The engagement ring, symbolizing loyalty to vows and promises, is displayed beneath the broken heart, representing the pain of a shattered relationship and indicating emotional wounds and injuries resulting from betrayal and abandonment that have led to feelings of sorrow and grief. The ivy and wall behind the woman symbolize resilience in the face of adversity, so she grips the wall with her right hand to prevent herself from collapsing from this traumatic event and a one-time heart attack. However, Calderon imbues the greenery of the ivy with shades of grayish hues, indicating the ineffectiveness of love and care. In ancient symbols, the ivy was given to the bride and groom as a symbol of eternal life, sacrifice, and loyalty. Additionally, the wilting lily flower, symbolizing faith and hope, hints at the end of love and relationships. The white dress with a lace collar and sleeves under a black coat and purple skirt symbolizes purity, sorrow, and dignity, creating a visual palette of internal conflict and emotional turmoil that reflects the complex feelings of the painted lady. Calderon, in this artwork, depicts the complex relationship between human relationships and physiological well-being through artistic expression and the use of medical symbols. Using a range of artistic techniques, he skillfully conveys the medical consequences of a heart attack through subtle yet impactful details, using facial expressions and body language to convey the onset of a heart attack. The hand placed under the heart and the pained and closed eyes of the woman indicate characteristic signs of cardiac distress, such as chest pain and shortness of breath. Calderon captures a sense of urgency and vulnerability through the physical behavior of the figure, emphasizing the intensity of the situation. In addition to the physical behavior of the figure, Calderon's artwork contains other symbolic elements that allude to the medical consequences of a heart attack. The pale face and lifeless body allude to the severe physiological conditions caused by sudden emotional stress and highlight the impact that emotional betrayal can have on cardiovascular health. These subtle yet powerful details help deepen the narrative of the painting. He also uses lighting and composition, the contrast between light and shadow, to highlight the physical turmoil of the figure and draw attention to the intersection of emotional turmoil and physiological vulnerability, presenting a visually captivating narrative. In Broken Vows, by intertwining themes of emotional turmoil and physiological vulnerability with the medical consequences of a heart attack within the framework of romantic betrayal and human relationship complexities, Calderon has skillfully depicted them. Through a deeper exploration of the complexities of the human heart, both metaphorically and physiologically, the profound impact that a broken vow can have on physical well-being becomes evident. From a medical perspective, emotional stress and the blow caused by a broken heart can be accompanied by a range of physiological responses and lead to serious health consequences, including heart attacks and other cardiovascular diseases.